So my name's Belinda Reeves and I'm a dietitian here at Mercy Ascot.
My name's Lou Char. I'm a clinical nurse specialist for surgical oncology.
As a dietitian at Mercy, my job entails seeing patients on the ward post-surgery. You know, a lot of these patients have got eating, chewing difficulties, swallowing difficulties, so I work with them to modify their diet to ensure that they're meeting their nutritional requirements.
So my role is coordinating care and communicating with everyone. I'm on the wards seeing the patients every day. I set up my own outpatient clinic with Belinda, the dietitian. We have a joint clinic once a week.
So the elements that are really unique here at Mercy are the timeframes from diagnosis to treatment and treating every patient as an individual.
We start the journey right from day dot, so we pick up GP referrals and they go to the Mercy Neck Lump Clinic or our Auckland Head and Neck Service here at Mercy Ascot, and then from there they get potentially a diagnosis there and then. We have a weekly multidisciplinary meeting which involves all of us, radiologists, oncologists, surgeons, dietitian, myself. We really want to make sure that this patient gets the best outcome and that we provide excellent service. The unique service that Belinda and I set up as an outpatient is that we've got a real ethos about nutrition and wound healing. So Belinda ensures that there's enough protein and nutrition and this patient is getting, and this is aiding the wounds healing, which is really important for the patient's well-being. The great thing about our MDM, or multidisciplinary team, is that it's a group of experts. So it's not just one person making a decision and saying this is what you need to have done. It's a big collective group and we all talk and discuss the positives of the surgery and the potential outcomes, and as a group it's decided on what's the best optimal treatment plan for that patient. The patient meets everyone, so they have a consult with the surgeons, myself and Belinda, speech therapy and swallow experts. From there, the patient and their family get a full pre-op consult.
So I attend the multidisciplinary meeting held here at Mercy where patients are discussed and their treatment plans are made, and so that's a really good time for me to find out what patients are coming through and then advocate for them if they need a feeding tube at that stage, so we'll get that done before they come in for surgery.
And throughout the whole journey from that initial appointment right through to their recovery, that we're there every step of the way. The great thing about working at Mercy Ascot and within the Head and Neck Service is that we are evolving all the time. So we learn from our patients and what things we could do better. And so since we've started, we've got better and better, I think, of providing the best possible treatment for them.
Mercy Ascot is working with Southern Cross to promote a big care package, so it'll be a wraparound service that will help enhance the patient's recovery and journey through their treatment.
The reassurance that the patient and their family are in expert hands and you're going to be looked after from day one and right through to the end of your treatment.
A lot of patients will come through the Neck Lump Clinic and then we discuss those patients at the MDM. So at the MDM we'll have obviously the surgeons, a radiation oncologist, a medical oncologist, clinical nurse specialist, myself, and other members of the team. And here we'll obviously talk about the patient and what the planned treatment is. And it's an opportunity for people from different specialties to, advocate for that patient around what sort of input they need. Not one individual person's going to be able to carry that patient all the way through their treatment. A number of these patients will go on to have radiotherapy, and so then I follow them all the way through radiotherapy. I see them weekly, if not more frequently in clinic. And then once that's finished, these patients are really eating is a real struggle for a lot of these patients, and then so Lou and I see them frequently as an outpatient right through until they no longer need our support. So the Mercy Ascot Head and Neck Support Group is something that Lou and I have set up after we got a lot of feedback from patients sort of saying, you know, they get to the end of their treatment and they would like to carry on with support. And so we set up a group that meets 4 times a year.
And it's really awesome for the patients coming through that are just finishing their treatment, who are struggling still with eating and drinking, to see that they can actually get back to, you know, a normal lifestyle, I suppose, and back to living a better life. Not to hesitate to refer on, even if they think it's something minor. It's quite often the ones that are minor that can be something quite serious. So to refer them to the Neck Lump Clinic.
This group of patients, and you know, focusing on their nutrition part, they are really at risk of malnutrition prior, during, and after treatment. So, and here at Mercy, we work really closely with our clinical nurse specialists, with our surgeons, and the whole MDT to really achieve the best possible outcomes for these patients. We really focus on the patient and treat everyone as an individual. So, you know, one person, even though they're having the same surgery, are very different. So we're really patient focused.
Don't hesitate, and it's easy to get an appointment with the Neck Lump Clinic. Anything that's, you know, a lump that's anything that's raised, ulcerated, or a lump that just is sticking around for more than 3 weeks, it's really important to come and see us. The team really care. We've got a huge amount of empathy for all our patients, and you know, we want you to get back to the best possible outcomes you can, and early intervention, early treatment is going to get you back to living your life to the fullest.